we did homeschool our kids for 5 years, and it was fun. So I had a sign on the door: do not open the door or knock on the door unless there's an emergency. And I wrote down, emergency consists of.
Welcome to the Critical Chats podcast,
or as I'd like to call it, Crit Chat,
where we talk about the new and exciting developments in the critical care world and get to know the providers behind the medicine.
I am Sheila Bilica, PA.
And I'm Katie Shakura, PA. We're your hosts, and we're with our producer, Sneha.
I'm also a PA.
3 PAs on a pod.
Hi, everyone. We are here with our very own Sheila Bilica. She's beauty, she's brains, she's sassy, she's a full package. But people, she's taken. Sheila was born in Port-au-Prince, Haiti, and moved to the U.S. when she was 19 years old. She went to college at the University of Bridgeport, where she met her handsome husband in biology class. They got married, and she pursued becoming a PA. She started off her career while raising 2 sons, and she had practiced in a multitude of settings: neurosurgery, cardiac surgery, cardiology, outpatient internal medicine, urgent care, and then she finally landed with us in the surgical and neuro ICUs at UMass. She's been working in these ICUs for 10 years. She then recently earned her doctorate of medical science in emergency management and global health at Lynchburg University. She additionally earned a green belt certification from the Lean Six Sigma program. Sheila, welcome to our podcast. Oh wait, welcome to your podcast, considering you're the OG podcaster.
I am old.
Oh, we didn't quite say that. You're the OG. That was a good introduction, Katie. That was a lot to say because you're magnificent in all the things that you do, Sheila.
Yeah, that's a lot of meat.
It's true.
Thank you, guys.
I'm sure there is so much more that we need to learn about you. Tell us a little bit more about yourself. Go a little bit deeper.
Well, I love to read.
No surprise.
And I love both of you.
We love you too. Yeah. And you're a huge nerd. We know this.
Yes.
We're all nerds together.
Yes. Of course. I love nerds. But I think for the purposes of this, we should probably keep going.
Not talk
about me.
If anyone doesn't know, Sheila doesn't like talking about herself, but we're going to bring a little bit of pizzazz to the podcast and bring some things out of her. Right, Katie?
Oh, 100%.
Absolutely.
Don't gang up on me, ladies.
So the topic of today's podcast is going to be kind of what you've been working on so far. You've done the Quality Scholars Program.
Can I talk about that?
Yeah, so to be honest, I didn't know what that was. Can you tell me about the Quality Scholars Program and this green belt that you have?
Yes. So the Quality Scholars Program is a program that works to focus on projects that will improve the quality of the system. And it was started by Toyota, and that's another, the Toyota engineers.
We have no disclosures.
The Toyota engineers. But what UMass has done is offer it to all employees, and the employees who want to pursue that belt, a green belt, after having pursued the yellow belt, are able to join and think of something that they want to improve in their department, and make it happen.
I guess there's a lot of things that can be more efficient in medicine, so that's awesome.
Yes.
It's a good mission.
So it almost sounds like a way for the hospital to empower its employees and kind of whoever wants to be involved to make the hospital better as a whole. So they're kind of involving everyone in the program.
I am very proud to say that is a very good idea, and I'm very happy that I was able to participate.
How did you learn about it?
Well, they sent a wide email, I think a system-wide email to everyone saying that if you are interested in joining the Quality Scholars Program, you can apply. You just have to make sure that your department head agrees to sponsor you or support you, because obviously we're gonna donate time, so we'll have to take time out of our busy lives to do the project, and but we need to make sure that our department heads are okay with it, and our department heads very supportive.
Yeah, I'm sure they're very okay
Yes.
with it.
Yeah. I mean, which department head wouldn't want you to make the ICUs better or make, whatever part of hospital you work better? That's great. It's amazing.
And in our cohorts, we had physicians, we had nurses, we had MAs, so it was excellent.
Wow. So this was in you mean your class? Like, I don't know if it's considered a class.
Yes,
or...
they call it a cohort.
Okay, so they included pretty much everybody in the cohorts
Yes.
to improve whatever project that they
That's
felt
right.
they needed to.
And then everyone, once they decided on their project, we're set up with a mentor as well, a mentor who's gone through the program, and I'm now a mentor. So
Are you taking mentees?
I already have a mentee.
Aw, Katie was volunteering as tribute.
It was a sweet moment. It was a sweet moment. Like here.
And then you have a sponsor, and then that sponsor is a stakeholder, and we have a team to develop the actual project, to talk about it, and to bring it together, and you implement it. And the hope is after implementation, it survives, the project.
Gotcha. So it's not a finite period of time where you're just doing this project, just for the white or the green belt. You're doing it really to improve the system. That's admirable. I think
it's admirable.
Absolutely. In addition to all the other things you've done and all the things you do.
Yeah, what time do you have?
Right?
Well,
Probably don't.
I thought you guys were talking about the program. I agree, it is admirable, not me.
She's just another cog on the wheel,
Oh, yeah.
That's what I am. Right? Yes.
It's absolutely not true, guys. For those of you who know Sheila, you know it's not true.
Then I really, so you want to know what I thought about? The fact that I'm sleep deprived. As you know, Katie.
Yes. So this is very true. You're probably up late reading. But this kind of brings me to the question of this sleep protocol that you kind of came up with.
Mm-hmm.
That was your Quality Scholars project.
Correct.
So why is this so important to you? And what's it all about?
Well, we love data, as we talked about a little earlier. We love data in the ICU. We collect them every second of the day, every minute. And all I hear 95% of the time, Sheila, you need to come to room 5 because the person is delirious. Yeah. The person is we need some help though.
Yeah, we need restraints. We need the vest. They're biting us. Yeah. I guess like an 8-year-old woman who's just biting their nurse.
Yeah, biting their nurse or biting through the restraints. Somehow getting mitts off while being restrained.
Exactly.
It's magic.
And you know what I feel sad about kids? Because you guys are like 10 years old and I'm like 100.
Sure.
You know what I feel badly about is the poor patient. All I'm thinking is that, wow, you're having a tough time. And the family members who were like, they're not like this. He's never like that. And she would never do such a thing. I'm so sorry. They called your name. We know what name I got called. And they hit you.
Yeah. Well, it's like you take them out of their natural environment at home with their nice bed. Right. You put them in an ICU. Some rooms don't even have doors. Oh my gosh. And they don't have windows to the outside world. They have no idea what time it is.
It's like a prison cell.
It is a form of torture. Yeah. I mean, sleep deprivation is torture.
Yes, absolutely.
And we can attest because we work night shift.
That's right.
We do.
I can feel my telomeres shortening right now.
I think we're all nerds now.
We're very sorry about your telomeres.
All of us, ours are shortening right now. It's a hard environment, huh? Yeah. So that's why you decided to.
So that's why, and because, like I said, we collect data all the time. I said, okay, so let's take one of those, ICU data sets. chem ICU so far. So it's not, I didn't do it on purpose, but it's just something. I was like, well, what about the SOFA score? Anyway, that's what I did. The SOFA score is mainly for sepsis. Okay, as you guys know, we talked about sepsis.
We talk about sepsis all the time.
Yes, so of course for sepsis, but the SOFA score of less than 12 is the number we landed on, because a SOFA score of over 12 in the literature has shown to be predictive of death in 48 hours.
So that was like your big inclusion criteria.
So I wanted to make sure the patient had a SOFA score of less than 12, not be on pressors, and if I would do of less than 60% people of less than 10, and for the patient not to require insulin every 2 hours or every hour.
The TKA patients.
Yes.
God bless them.
And vital signs every hour if they're on pressors, things like that.
Okay.
Remember that patient?
The one that needed Q2-hour eye drops.
Yes.
Like, imagine crying their eyes open at 2 a.m.
Yes.
Like, very counterproductive to
needless to say, that patient wasn't part of didn't make it.
That was like an asterisk at the bottom. That was
exclusion.
Eye drops. Honorable mention.
Yeah, right.
Very nice. So we came up with labels.
I love it. So the labels, so it stands for L is...
So it's L, L,
lowercase.
capital L,
So it's capital
L, lowercase a, capital B, capital E, capital L, and capital S. So the lab is the first one. Lab. So labs after 5 a.m. Because we always
Oh my gosh.
get
2
them at
a.m.,
3
3
a.m.
a.m.
Yes,
labs.
yes.
Yep.
Labs to be drawn after 5 a.m. Baths to be avoided between midnight and 5 a.m. So the LAB, B is for bath, E is for ear masks and earplugs to be given, L is for lights to be turned down along with TV, and then S is for signs, vital signs to be held or to be changed to Q4 hours, like on the floors.
Floor.
Yeah.
And we also put the signs outside the door so the nurses know to stay away.
Yes. And the other several residents who come in to try to
get ahead on rounds. They come in at 4 a.m. with all their patients, wake them up.
I mean, you can't blame them, but again, the poor patients suffer.
And it's patient-centered care.
Yes. So I really feel badly for patients who don't get to sleep.
I think it's important. I mean, I think some of the best projects that people come up with out there are born out of sympathy, empathy for the patients. And I mean, who can't relate to sleep? I think especially you, Katie, as you know recently, but
I just want a baby, so it's kind of like my own sort of torture, waking up every hour.
Right.
Like, you might as well be checking my sugars.
Yeah, exactly. You're like, is this what patients feel like? And you're not sick.
I'm not
in ways, right?
At least I'm in my own bed.
Right.
And at least there's a door.
Right. And you can see your loved ones.
That is true.
Yeah. So I think the best projects are born out of empathy, and so I think this is going to be a great thing.
I think this is much better than having those signs with a picture of a sun or a moon on the wall to remind them what time of day it is. Like, this is
that's dire need.
That is emergency.
When you don't have any windows whatsoever in the ICUs, that's what we do. Yeah. That's sad.
So the ICU rest protocol ran for 3 weeks, and patients spent an average of 2.7 days on it. We had 3 patients who came into the ICU due to delirium because, as you know, when they're so delirious, they're at risks of falling, and then they have to be placed on Precedex infusions, and they can be on the floor. So these patients came over to us, and then they were able to be discharged within 3 days and not be delirious after they were placed on the labels for the pumps.
That's incredible. That's an incredible
outcome. I mean, it's like great for the patient, saving the hospital money on things like dexmedetomidate, olanzapine, ICU stay, hospital stay. I mean, it's overall a good thing.
Yeah.
I think in general, too, we end up giving, especially overnights, we end up giving a lot of medications when it may not be warranted, right? And so if we focus on prevention, then we won't be giving, as Katie said, we won't be giving all of those medications.
Yeah, there are studies about ICU survivors, patients who survive ICUs, and how they have PTSD and they have all sorts of problems from having been in the ICU.
Right.
And we want them to not have those things. They didn't come with those things. We don't want them to live with those kind of
So you started this protocol at one particular ICU at UMass.
Yes.
And now you're sort of spreading it out. There's multiple ICUs that I've seen the signs up. I've been, implementing the labels protocol where it's deemed necessary. What is your goal? Do you want to just spread it throughout the state if possible? I mean, if successful.
Well, I think a lot smaller than you do.
Baby steps.
Exactly. Yes, I'm hoping that the entire UMass system can use labels eventually. We need to be more humane.
Yeah.
We need to think of the patients and the restoration that sleep provides should be part of our care for them. So.
How do you envision implementing it? I think you mentioned putting the sign up on the door. Should this be a discussion during rounds? And what will the discussion look like if?
I've been told that nurses do bring it up because the nurses who helped us with the team of nurses who helped us with these ideas really liked it and do remind the providers when they're doing rounds to implement it. And we're also hoping to have a Epic order set.
Oh, that's awesome.
Oh, because right now, so the way we have it set up right now is we have to put a nurse communication in,
Correct.
which works in a sense. Right. But if you don't have the dot phrase and then during rounds it belabors it. But I think that would be kind of a great tool to have where you just type in labels and it pops up and you can just have it on there.
Exactly.
It's actually a great idea.
Possible.
Yeah.
And then it just becomes like a culture shift.
Right.
And, when the whole ICUs at UMass are doing this, it just becomes a no-brainer. I mean, I feel like if it's not a culture thing, you have to think twice about it. Maybe you forget about it. You're so caught up in your septic patient or whoever's in cardiogenic shock. You're not even thinking about that. But we got to think of those sleepy people.
Yeah,
absolutely. I think you mentioned earlier too. You said there's nurses involved. Who else? Because from my understanding, there was a whole team that was involved in implementing this protocol.
So we had meetings. Between 4 nurses in the CICU and a CNA, myself, and then Johnny Eisenberger. And then our sponsor was Dr. Ferris, because he's the director of CICU by extension. So was the CICU nurse manager at the time, who I think he was the CQ nurse manager assistant, Chris Perkins, and my mentor was Karen Toro. She's from the project management, the quality improvement department.
I see. Okay, so it was a very kind of multidisciplinary thing. You talked to each of these kind of professions. So, down to the level of nurse, CRNA, all of the levels were kind of involved in making sure that the patient is sleeping.
We were hoping at one point to write a huge paper on it. So we are doing, we had a librarian gathering a lot of data, a lot of articles on sleep and the effect of delirium also. And 3 of the DNP students were also helping us.
Oh, okay.
Yeah, so eventually we want it to be a big deal. We want to write it up, but we're not at that point yet. all of us are so busy.
Yes,
Yeah.
yes.
So
I think it has good potential.
I think it's great potential.
Just from the sounds of kind of how you went about doing it, you got this whole team involved. You're thinking about how you're going to implement it from a provider and also from kind of a bedside nurse perspective. I think you've kind of got everything put together. It's just time, right? And you need to be able to sleep, Sheila. That's the whole point, right? You can't be writing this paper up at 2 a.m.
no, but to watch me, I don't sleep well.
Sheila, I'm going to put the labels protocol sign on your bedroom.
Oh yeah, that's a great idea.
Don't disturb. Do not disturb. Your kids can't come in. Husband
I know.
can't come in.
Well, when we did homeschool our kids for 5 years, and it was fun. So I had a sign on the door: do not open the door or knock on the door unless there's an emergency. And I wrote down emergency consists of, which
Inclusion
of the
criteria.
Oh yes, inclusion criteria.
Sheila.
Which of the dogs were sick or vomiting blood.
Not just bile, blood.
If dad wasn't answering you and he looked like he was, stroking out. So those were or your brother was,
Call 911 before you call me.
Yeah, right?
Well, yeah.
So since a young age, you were doing the labels protocol.
Oh, yeah, definitely.
Wow.
The real
Yeah, right? We've come full circle. Look at you now.
That's right.
And now everyone will be on the labels protocol, including Katie and I.
I appreciate that.
Definitely.
Well, thank you so much for talking to us about this. This was awesome.
Yeah. Awesome.
It was a great kind of look into Delirium. It was a great look into how we can improve the ICUs. And I think I really appreciate that it was a project born out of empathy. I think those are the ones that are successful, right?
Absolutely. And I'm sorry about your telomeres.
It's okay. One day we'll all just be getting cancer from our shortened telomeres.
No, none of that. We'll repair them. We'll just be such great clinicians. We'll repair them, right?
That's true.
Someone smart out there. Get at it. Someone smart out there.
Thank you very much for having me at
your own podcast.
Yeah.
Yes.
Being on the other side.
Yes.
How did it feel being on the other side?
A little scary.
Yeah?
You don't like talking about yourself.
No.
But alas, we must.
Alas.
You did great.
Yeah.
Thanks.
Thank you, Sheila, again. Until next time.
Sheila
will be on the other side, next to Katie.
Yeah, that's true.
We look forward to that.
That's right. And where would Sneha be?
I will be in the background. Yeah, behind the scenes, guys. It's where I belong. I'll make an appearance here and there. They're upset at me.
We appreciate you fixing the microphones, so.
I try. Sheila, I have one more question for you. What's your anthem song?
Good question.
Actually, it was Sheila's idea to ask that question of our guests.
That's true. This Is Me. Do you know this? Do you know the? Oh my God! What is the name of the play? The Greatest Showman. That's right.
All right.
The song "This Is Me" by
That's a
Sheila Settle. I think her name is. Yeah.
I love it.
Same one.
C'est moi.
Same one.
Mm-hmm. C'est moi.
That's a wrap. That's our second episode.
Yay!
Thank you guys for tuning in. Yeah.
Tune in for the next one. Who knows who our guest is going to be?
Yes, who knows? A huge thank you to the team members, the CQ Memorial nurses, especially Keisha, Angelica, Yahara, Marissa, Johnny, my sponsors, Dr. Ferris, Chris Perkins, my mentor, Karen Utaro, of course, my bosses who supported me through all this and continue to do so, my friends Alex and Charlotte who helped me through this, and Michael Bilica, of course, and to the DNP students, Stefan, Rachel, and Mark. Thank you. Thank you for joining us on another episode of the Crit Chat podcast.
It's critical chat, Sheila.
Remember, you can watch the podcast video on YouTube or listen to us on Spotify, Apple Music, CastBox, or Amazon Music.
Everywhere.